Breaking news, ladies. Registration is now open for the Fertility Awareness Mastery Mentorship Program, Class of 2023, and we start the first week of January. If you are a women's health professional with an existing practice and you've struggled to incorporate fertility awareness cycle charting into your client work, this is the program you've been waiting for. There's nothing like it offered anywhere. Transform your practice in 9 months. We start the first week of January 2023. Apply now at fertilityfriday.com/FAMM live. That's fertilityfriday.com/FAMMLIVE. This is the Fertility Friday podcast, episode number 438. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Workbook. I'm a certified fertility awareness educator and holistic reproductive health practitioner with over 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormone health, and optimizing the menstrual cycle without hormones. I have been consistently outspoken about hormonal birth control over the past 2 decades and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I teach women's health professionals how to utilize the menstrual cycle as a vital sign in their practices, and I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys and a brand new baby girl. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with me today. Today I'm sharing the first episode in this year's FAMM Practitioner series. This is my Fertility Awareness Mastery Mentorship series, where I'm sharing interviews with my current practitioners. I have so many great episodes for you in this series with such a wide variety of topics, with my practitioners sharing their own personal stories, with birth control, with fertility awareness, what brought them to want to introduce fertility awareness as a vital sign in their practice, to some episodes specifically related to their professional designation and on the topics of their specialty. So lots of great episodes in store for you. Today I'm sharing my interview with Melissa Thompson, a member of the FAMM class of 2022. And because her specialization is in the area of pelvic floor health and pelvic floor physiotherapy, we spend a lot of today's call going deep into pelvic health. Although in some parts of the world, pelvic floor PT is the standard of care, particularly for women postpartum. What I found living in Canada and my knowledge of, North America in particular, so Canada and the United States, it is not necessarily the standard of care. All women aren't necessarily referred to a pelvic floor PT as just the way things are done. And many women struggle with the issues associated with this, such as bladder control issues, painful sex, uterine prolapse, a lot of different things that can happen post-birth. And it's not necessarily common knowledge what to do about those things. I think many women are just left with the thought that they just have to deal with it. So in today's episode, we delve into some of these topics, and Melissa shares her experience, expertise, and some really important pieces of information and a lot of hope and encouragement if you've ever struggled with any of these issues, or if you are pregnant or thinking about having a baby in the future. Even that is a really good time to learn a little bit more about this so that if you do encounter any challenges, that you have at least a bit of a roadmap for where to start looking. So before we jump into today's episode, I'll just tell you a little bit more about Melissa. Dr. Melissa Thompson is a board-certified doctor of physical therapy with a specialty certification in manual therapy, a tool for hands-on treatment. She is also a pelvic health specialist with an advanced certification in fertility awareness. Melissa helps connect her clients' menstrual cycle health to their pelvic health so they can heal pelvic pain, relieve bladder issues, and take charge of their fertility. Melissa was born and raised in Louisiana, and she now lives in Houma, LA. Hope I said that right, with her husband, and they are enjoying getting to know the community and giving back with her practice, Louisiana Pelvic Health. So without further ado, let's go ahead and jump into today's episode with Melissa. And I'm really excited to be here today with Dr. Melissa Thompson. Melissa is a member of the 2022 FAMM program. And so by this point, at the time that we're recording, we have been together for, it feels like a full year, but I would say a solid, what month is it? A solid 8 months together. And so we've had a number of in-class sessions, hot seat sessions, client sessions where she's had the opportunity to share about her practicum clients. So we've had just a wonderful opportunity throughout this program to get to know each other, and really excited to have you on the podcast. So welcome to the show, Melissa.
Thank you. I'm really excited to be here.
Well, I'm glad to have you. And I feel like a great way to start our conversation today is to let the listeners know a little bit about yourself. So maybe we can start there. Let us know what your background is, your professional designation. Talk to us a little bit about the work that you do, and then tell us, as you're doing that, what prompted you to join the FAMM program and want to basically bring the deeper fertility awareness knowledge into your practice.
Yeah, so my name's Dr. Melissa Thompson. I'm a doctor of physical therapy. So I practice as a physical therapist in Louisiana, and I have a women's health clinic. So I focus a lot of my caseload on pelvic floor conditions, on the pregnancy, postpartum, postmenopause kind of transitions. And then also I do see a strong amount of those who are trying to get pregnant and have things like endometriosis or these more like chronic, really multifactorial conditions. And so in my clinic, I went off on my own because I was just kind of tired of the approach of just lying on the table, Kegling, and having a biofeedback machine inserted into your vaginal opening for half the session and calling that therapy. And when are you really leaking urine when you're just laying down in bed doing nothing? It's not really functional. Most people are having their issues when they're up and about and doing activities and doing things. So my clinic in a nutshell is just kind of putting things into a more functional perspective, combining the best of orthopedic hands-on physical therapy with expert pelvic health, and just really getting people better faster.
Well, yeah, thank you for that summary. I want to go a little bit deeper into what you said, because I feel like, from what I hear in Europe, it's standard procedure, postpartum for women to be referred for pelvic floor physical therapy. But in North America, obviously that's not the standard of care. And so I feel like a lot of people don't necessarily have a good background knowledge of what it is. So when you shared with us your kind of displeasure with the standard approach, maybe talk to us a little bit more about that. So for someone who just goes into a physical pelvic floor PT, basically, maybe share with us some of the reasons why a person would end up in your office and what the standard approach is, what a person would expect, and then go into a little bit more about like how your approach is different.
Yeah, certainly in North America, like we all wish more people were coming to us, and we wish more of our doctors in our community were just making women more aware. The typical approach is to really kind of zone into one body part. So my neck hurts, let's look at your neck. My back hurts, let's look at your back. My vagina hurts, let's look at your vagina. But what we know is you're not just a walking vulva. Like it's your legs, your core, your rib cage, your neck. It's how you move as like a full body unit. And so I would say like pretty standard of care, like years ago, pelvic PT was more known for having an internal vaginal exam and just getting like directed vaginal treatments, and usually in a static posture. So like lying on the table, and then like giving exercises that would be more of like Kegling in nature, which is kind of like the pelvic floor contraction, or what you hear. This is all over social media, all over Instagram. Did you do your Kegels today because you're pregnant and you're going to have a baby? And I actually
And what are Kegels for the 6 people who don't know?
Yeah. So a Kegel is when you isolate just the vaginal muscles and you contract them. So it's analogous to a bicep curl, but just for the pelvic floor muscles. And there's some theory to that, if you've had a vaginal birth and things are really stretched out and your pelvic floor is just weak and you're feeling pressure and you're leaking, well, yeah, maybe we need to reconnect with how to perform that Kegel. But what's happening when you're lifting your 20-pound child? You're now having to use your legs, your core, your breath, and your pelvic floor. And those should be automatic. So kind of moving away from that dogmatic approach of just do your Kegels and look at a machine that shows you if you're Kegeling or not, and really moving into what's your pelvis doing? What's your diaphragm doing? What's your core doing? Are you holding your breath all the time? And then what's your pelvic floor doing in conjunction with all of that?
Mm-hmm. Yeah, that's really, I mean, it makes a lot of sense when you break it down that way. And I know the whole Kegel conversation, I feel like it's changed over the past 20 years. I feel like when I was younger, there was this whole thing of, you need to do your Kegels all the time and all of that kind of stuff. And it makes me think back of an interview that I did with Isa Herrera. And she talked a lot about how the Kegels is the kind of contracting part, but then a lot of women have issues with relaxing, and how if you always do the contractions, it might make issues worse for women who are having, say, pain with sex or things like that. So maybe share with us some of the most common reasons why people do end up in your office.
Pain with sex is the number one reason for someone that I see personally. So I find that a lot of these people, we spend more time trying to let go of the pelvic floor and tapping into the nervous system and all of the other contributions to everything. So pain with sex, and then stress urinary incontinence, which is basically like I'm trying to get back to exercise and oops, I peed all over myself. That's super, super common, but a lot of people just don't want to talk about it. Prolapse, which is where like one of your pelvic organs is just not in the right spot. And so then it causes a lot of mismatches with peeing, pooping, and just feeling like something's always in your pelvic region, like hanging out. Low back pain and sciatica and hip pain are also super common reasons to come see me, because sometimes the missing link is the pelvic floor and how everything's behaving together. And then constipation and poo problems. And then a lot of this kind of comes up during the fertility years, pregnancy, postpartum, post-hysterectomy. So it does tend to all overlap with a lot of people having goals to get pregnant, or maybe to prevent pregnancy, or to one day, like, how do I transition into menopause? So we're constantly having the hormone conversation as well.
Mm-hmm. Well, and when I think about, there's so much in what you said that I could ask questions about, but in general, I mean, when I think about, as a practitioner, when to really be thinking about referring to a pelvic floor PT, I often think around the birth years, like, as you said, postpartum, and obviously with the pain with sex and things like that. So maybe you can speak to a little bit about why birth itself, the process of birth. And I would imagine that it's not just vaginal birth. I would imagine that. So maybe you could speak to that as well, because of course that would be the thought of, oh, only if you have a vaginal birth would you need a pelvic floor PT. But I'm sure pregnancy does things as well. So you could speak to that. But also outside of birth, maybe because pain with sex is the number one, what is causing these problems?
Yeah, I love these questions. So I view pregnancy as more of a wellness preventative type of treatment, which is what I'm really promoting in my clinic, because it is so cool to be able to proactively do therapy on the front end, prepare for birth, and then basically improve maternal outcomes from all sides. So that's how I set up my in-person and my digital programs for pregnancy. And you have to think about the 10 months that your belly is growing, your thoracic spine is getting stiff, you're probably more forward in your shoulders, changing your neck position. We haven't even started talking about the pelvis yet. And the belly starts hanging forwards and all the pressure just starts going all up and down and front to back. And so that causes just a ton of changes muscularly. to the pelvis, pelvic floor. And so in my opinion, everybody who's pregnant should be going to see a pelvic PT, at least to get a check and to make sure all that stuff is kind of crossing your T's and dotting your I's and that you know how to push. A lot of moms are actually doing the opposite with their pelvic floor. And there's some research out there that shows that when you ask somebody how to Kegel, 70% will not know how to Kegel. I'm sorry, I got this stat wrong. When you ask somebody if they don't know how to Kegel and then you cue them, 70% can learn within session how to do it correctly. So how cool is that to be able to just have like a little bit of teaching to make sure that you know what you're doing with your pelvic floor. So that's how like pregnancy itself relates to pelvic PT. And then of course with the birth, it just all depends on how it goes. And yes, if you have a C-section, you still have that abdominal scar that affects the mobility of the pelvic organs. And then it causes like a reaction sometimes with the pelvic floor where things don't want to let go because of those adhesions and scar tissues. And then a total disconnection with the abdominal cavity and the abdominal muscles. So that's like pregnancy in a nutshell. I know a lot of people do associate the pelvic floor treatments with pregnancy, but a lot of my people with pain with sex, this has been going on forever, like ever since they became sexually active, and there was no real like insult or injury. And so what happens is they start to go on a health journey and they start to ask the questions, is this normal? It's always been like this is my experience. And they start to branch out and realize that sex can be pleasurable, it can feel good, and it doesn't have to be that way. And for a lot of these people, they go down the rabbit hole of kind of getting a lot of gynecological exams, a lot of infection swabs. Their cervix looks normal. You know, they don't really have any conditions, so to speak, that can be ruled in. And so then they come to me and we find lots of tension in the pelvic floor, lots of maybe tension in the abdominal cavity and in the hips. There's all these like gripping patterns. And I'm able to kind of say, okay, I think this is coming from a hormone contribution, or this might be consistent with endometriosis or a pudendal nerve irritation. I'm getting into like super specific diagnoses now, but so that's kind of my job, is to say like, why do we think this is happening? And then what do the next steps really look like from there?
Well, and just to give us a general sense of it, because as someone who has not personally experienced pelvic floor PT, now I've done a lot of interviews with the abdominal therapy modality folks. So Mercier therapy, Arvigo, and those are a different, obviously completely different thing where you're going on the top of the abdomen, you're not going internally, and you're doing more in terms of alignment and circulation and things like that. Whereas obviously you've already mentioned and alluded to it, that with pelvic floor PT, there's often an internal exam, and it's a very different approach. So maybe you could just share a little bit about the approach itself, how it's different, and maybe some of what happens, like how do you get better? Just for the woman who's listening who does have pain with sex, that's a big topic. I know for me, I often talk about that possibility of hormonal contraceptives playing into that, because that's certainly in the research, but obviously there's a lot more to it than that. But that's something I always like I just want that to be part of like, this could be why too. But anyways, maybe share a little bit about how you, obviously, you know, you can go into as much or as little depth as you want, because I'm sure we could spend the whole podcast talking about that. But just to give a general sense to the listener of what do you do for your clients who have pain with sex, or what do you do for your clients who are peeing when they exercise?
Yeah, so this is everybody's kind of favorite question. Like, what is going to happen if I go see you?
What are you doing to my vagina? Like, what?
Like, I'm too scared to do this. And I want to say that like nothing is required in the exam. It's a fluid collaboration between myself and the patient. You know, we all want to be comfortable before we move forward with internal exams, but it is the gold standard way to assess the pelvic floor is with an internal exam. So that would be like your top notch. Like if you really want to know what exactly is going on and if a muscle in there or the pudendal nerve is involved, definitely an internal exam is something you should think about. So When you come to the clinic, we do lots of talking. It's probably lots more questions than you're used to be asking. I'm going to ask you all about your history because these issues don't manifest overnight. There's not pain with sex today and there wasn't yesterday. It's usually something that has been going on for a long time. So we really do have to dive into all the different body systems and your history of everything. And then after we kind of get to know each other and your goals and what your priorities are, I will plan the exam based on the priorities. So if I do think that an internal exam is the most appropriate for you, I usually bring out my model Ophelia and I kind of tell you how the pelvic floor shows up in this way and how pain with sex is potentially involved or leakage. And then we would move into the vaginal exam and I talk you through it. You're in control. If you decide, you know what, I'm halfway through this and I'm over it, then you're over it. We move on. There's no requirement there, but I'm able to use one glove lubricated finger to feel all the different layers of the muscles vaginally, all the way into your deep pelvic floor and your hip muscles. So the hip courses in and out through the pelvic floor along that pudendal nerve path as well. And a lot of people are holding a lot of their emotional trauma and their trigger points and their lumbar spine stiffness is kind of manifesting into some of those layers. So once we kind of identify exactly what the pelvic floor is telling us, then I zoom out because your treatment may not necessarily need to be just going internally every time. So I do a lot of lumbar work, thoracic spine work, because if your spine is not functioning at its optimal capacity, then it's potentially putting the pelvic floor in positions that it becomes the victim, where maybe we're seeing the symptoms at the pelvic floor, but it's not really the true cause. So I do a lot of spinal work, a lot of hip corrective exercise work, and I do some visceral and abdominal massage work, but not to the level of the Mercier or the Arvigo. I'm not trained in that. So that in a nutshell is kind of like how a session goes. And then for all like follow-up sessions, we will prioritize together like what we want to do. If we're doing more myofascial work along the spine and joint work or along the abdomen, and then there might be a component for like 10 or 15 minutes where we do the internal work if we're doing like release work, or if I'm helping you connect your vaginal area to your core area, which a lot of postpartum moms, it's just very disconnected because for 10 months there was like tension on the abdomen and you could really feel the feedback of activating those muscles. And then all of a sudden when the uterus starts to shrink and there's no baby in there anymore, everything just feels like it's like hanging out. And muscles that have been stretched to that capacity are not in the appropriate length tension relationship to get a good contraction. So we have to intentionally focus on how we're going to accomplish that and do it correctly and put it into activities like lifting your baby and picking up items in laundry and things.
Well, and then in terms of outcomes, so maybe share with us just in whatever makes sense in terms of the way that you share it with us, whether it's a general kind of comment or if you can think of a couple of client experiences that have been that you felt really good about, but maybe share with us some of the outcomes for, say, a client who had pain with sex or a client who did have bladder control issues.
Yeah, so I would say bladder control issues is the fastest track to improvement. A month or two of therapy and you should not be leaking. That is actually like really cool because, people call me and they're telling me like, I just don't even think anybody can help me with this issue. My OB told me, well, what do you expect? You had a baby. And I'm just here to tell everybody that that's just not true and that this can be fixed. Pain with sex it honestly depends on the root cause of it, but that's more like an ongoing. I would say that if you're experiencing that, sometimes you might kind of graduate from the coming more often to more of like a wellness or a home program that you're going to have to keep up with. But outcomes are really good if you get the right program, you get the right tools and you have the right support system and you're motivated and willing to slowly kind of address all the pieces of the pie. Because with the pain piece, there's always more to the story. So then there's going to be more for us to work on and more things for us to do.
Yeah, the pain is complex because then there's pain. So then you start to wince and tighten, in anticipation of pain, and that makes it worse. And so it makes sense that there's a lot to work through there. But that's really helpful. I feel like that really kind of opens the window into pelvic floor PT, so that I think one of the things I encounter with my clients is that often, many of us just think it's just doctors, and we go to the doctor, and if they don't have anything for us, then we kind of just like, well, now what? So one of the things I always like to do on the podcast is to kind of open it up so that we know that we can have a care team. It's not just the doctor, and there are plenty of things that doctors can't necessarily help us with that other trained professionals can support us with. And it doesn't always have to be drugs and surgery or whatever the case is. So yeah, I'm really glad that we went through that. So let's switch it up a little bit and talk about so again, what prompted you to want to bring fertility awareness into your practice? And obviously the FAMM program teaches fertility awareness, but it also goes a lot deeper into utilizing the menstrual cycle as a vital sign and having it there to help you as a diagnostic tool to some degree. And so maybe share with us a little bit about the why you wanted to bring that into your practice. And then, after that, you can share a little bit about how this experience has changed what has happened now that you've been incorporating these really cool fertility awareness tools into your practice.
Yeah. So the why behind it was that I started charting and I felt like everybody that I had questions for and asked, they would just tell me like, well, you have to ovulate on day 14. And if you don't, then, you're irregular, your cycle's irregular. And I felt like I need to dive deeper into this. I might want to get pregnant and I want to understand what my hormones are doing. So it's kind of twofold. Like I wanted to learn a lot for myself and kind of what I could do in my own hands. And then all of my patients have really deep goals. Like it might start with pain with sex, but then it might come out that I'm scared to get pregnant. And if this is like foreshadowing that there's going to be an potential issue with my fertility and kind of facing that. And I like to be able to use my holistic background and kind of look at things from all sides. And there's things that I can definitely do without referring them out. Like, are you eating breakfast? Are you, going to bed at the same time every day? Like I can have those conversations. And I can also, a lot of times when I do get some people with these issues, I can tell right away there's a hormone contribution. And so to be able to go deeper and just have that education and awareness and then be able to offer like more solutions without just going back to the gynecologist who often tells them, don't worry, we'll just send you on some Clomid or Letrozole if you're not ovulating when that time comes. And I just offer people, well, let's look at it as a different approach. Why don't we spend these months before that time comes on really optimizing things instead of just treating with an intervention in the immediacy based on what's going to happen later?
Mm-hmm. Well, I thought of a question. It's more of like a curiosity because obviously you have had your professional practice for quite a while. And obviously you have an intake process of your own where you would find an extensive history to help you support your client with their pelvic floor issues. So I'm curious because the FAMM process then has its own intake and its own kind of history and obviously lots and lots of questions to try to get a sense of what has led the person to wherever they are at now in terms of their birth control history and their health history and all that. So I'm curious if the FAMM intake process did that add to what you were already doing, and did it provide, I guess, additional history and background that you weren't necessarily getting already?
Yes, it definitely did. There are not a lot of patients that come to my clinic who have ever been asked to explain what they eat and or to talk about how much water they're drinking or the reproductive history of what has really gone on since menarche up to this point and how that all might be playing into a role. Because a lot of traditional physical therapy is, if someone says, well, 15 years ago, this and this happened, traditional physical therapy would probably go, it might not be relevant. But thinking about everyone's life journeys kind of shaping things up to today, I think it is relevant. And I especially think it's relevant when it becomes tied up into the hormonal and the nervous system.
Jumping into today's episode with some exciting news to share. The Fertility Awareness Mastery Mentorship Program, Class of 2023, starts in January. If you've been searching for a practical way to incorporate fertility awareness cycle charting into your existing women's health practice, then this is the program for you. The Fertility Awareness Mastery Mentorship is a 9-month program that provides the necessary training to incorporate fertility awareness cycle charting into your existing practice. This program cuts out all the fluff by combining the science with the practical application of charting and allows you to support your clients by monitoring their fifth vital sign in a standardized way. Finally, a program that teaches you to use the menstrual cycle as a diagnostic tool with your clients. Transform your practice in 9 months. Apply now at fertilityfriday.com/FAMMLive. That's fertilityfriday.com/FAMMLIVE. Now let's go ahead and jump back into today's episode. So part of the program, I would say probably fully half of it or something along those lines, is the practicum. And I think that's obviously the opportunity to apply what you've learned in the class with your clients in real time and have support with that as you go. So it's I think the most potentially, one of the most valuable, also one of the most time consuming and the most rewarding parts of the program. But maybe share with us what that's been like to incorporate that aspect of it into your clinical. I know we've had a lot of conversations about it because it can be challenging. You already have an existing way that you work with clients and now you're adding an extra kind of feature, but maybe share with us how that has been and what it has done to your client work. I'm sure you had an expectation coming into the program of that it's going to be beneficial and it's going to help you better serve your clients, but share with us what your actual experience of it has been now that you're kind of in the midst of it.
Yeah. So I think it's really interesting because since I started sharing on my Instagram that I'm now taking fertility awareness clients, even people who come see me for physical therapy, in my intake form, I have do you use contraception? And almost everybody says natural family planning or some level of Creighton or fertility awareness. And I just think that's super cool that I'm attracting these people without even necessarily getting into the weeds of, do you want to chart? Do you not? So I think that's been a really cool, just organic, magnet that has happened. And then I have played around with different ways how to incorporate true physical therapy with the charting. And I've decided to keep them separate just because we don't want to take time away from either avenue. We want to make sure we do it right. But it has given me a new lens to when someone comes in and they think it's their pelvic floor and we dive into it, and what they're telling me is maybe they have abdominal cramping and pain around ovulation and hip pain, and they think that it's all related to their pelvic floor after they've had a kid and a recent miscarriage. So we checked the pelvic floor and it's actually nothing like what I thought I was going to see based on those symptomologies. And so okay, we need to dive deeper into this. And I actually do have a client with that history. And what we found is through charting there's just other hormonal things going on. I think her estrogen's really high, and I think she's getting a lot of ovulation pain and inflammation. And, she's on this new journey now where she's keeping up with her rehab exercises, but she's also like really loving the charting and seeing the results. And she wants to get pregnant again, but of course she wants to improve her chances of having the live pregnancy go to term this time. And I think she's on a great path. And it's been really cool to see people's different struggles. I have a client with HA right now, and she's on cycle day 80 something since her IUD. And that's been really interesting because she had also pain with sex, and we weren't sure. She wanted to know if it was her pelvic floor. Well, I didn't think it was her pelvic floor. I thought it was the IUD. And after she removed the IUD, now there's no pain with sex in any of the times in the 80 days. And so I think it's really cool to be able to kind of add another layer of almost like differential diagnostics of how much percent of this is really the hormonal, inflammatory, GI issues, how much is the pelvic floor, and like me designing which avenue someone would benefit from going down.
Mm-hmm. And when you were saying that, I was thinking about it in terms of, so I think a lot of practitioners, especially as the knowledge of the menstrual cycle and the importance of it and all of those things, I feel like it's very popular right now. It's a very hot topic. And so I know a lot of practitioners might start asking about the person's periods and really feel like they're delving deep into it, et cetera. But obviously with this program, you know exactly what day of her cycle she's on because she's tracking. And you also have insight into the fact that that's highly problematic to have 80 days without ovulation and, what that could mean and et cetera, et cetera. So maybe share with us the difference between having a general understanding of the cycle and potentially how you were working with clients before, maybe even asking them about their periods and if they're regular or whatever, versus now actually having some of your clients chart and seeing with your eyes what their cycle really is like.
Yeah, so I was asking more period questions in relation to premenopause or endometriosis, but very few questions maybe about period pain or like how heavy are your periods. For premenopause, a lot of times when we're going through the menopause transition, there's a lot of vaginal atrophy and vaginal thinning, which leads to a new onset pain with sex presentation. So I would kind of ask them and be like, and I would say, okay, it sounds premenopausal, and then I would almost like move on from the from the hormone thing. I might recommend one of Lara Bryden's books or like something like that. But now I have people charting, and like with the person with HA, she just had 3 peak mucus days on days like 75, 76, 77. So I'm able to have the conversation with her that like what we're doing is working. We just need to continue the path. And I don't think she ovulated those 3 that day because things dried up and her temps didn't go up. But the fact that there's some ovarian function, some follicular development, and we were able to see that with the mucus, and she's getting negative LH tests, which a lot of people are relying on the LH to see if they're ovulating or not. This is really positive. And so I'm spending a lot of time like back and forth with the chart, telling her we don't need, things are working. And we just need more time to stay the course versus maybe someone who's not charting is just looking at it as 80 something days without a period. Do I do a jump start, whatever the hormonal, I forget, Provera or something.
the progesterone challenge test that they do.
So now I feel like I have a leg to stand on to give more advice of, it's working, and you don't if you want to go get that jump start, of course you're welcome to, but I think that your follicular development is on its way. And so I think that's really cool to be able to like see the tiny changes.
Mm-hmm. You're hitting on, I think, one of my favorite parts about charting and utilizing it as a vital sign. I think that there's a lot of different aspects of charting and different ways you can incorporate it into your practice and into trying to help you figure out what's going on with your client. But one of the things that I really appreciate about charting is kind of like the longer term benefits. So for example, and when I say longer term, I just mean, even following a client over 2-3 cycles, And so for example, you have that chart, you see what's going on, which in your client's case was nothing, no ovulation, no mucus, nothing, which is a classic HA presentation potentially, depending on the situation. And then you start to see, like you make changes based on the first, what we refer to as baseline chart. And then you see feedback. So you see what is actually happening and whether or not your actions are causing the changes that you're wanting to see. So in that respect, it gives you feedback. And I find it to be a very excellent motivational tool for clients. And also just for anyone who's charting themselves, it can be a great motivation to see the positive changes from what you've been doing. You spoke to that with relation to your client and how it was so motivating to see like what we're doing is working. We're seeing ovarian activity, which we weren't before. So we're on the right track. We just have to keep going. Have you had similar experiences with your own self, with your own charting? Because one of the aspects of the program, in addition to supporting clients, is to chart your own cycles so that you can have that experience yourself. And also with clients, like how have you found that process of using the chart as a feedback tool for motivating clients and yourself?
Yeah, I think that's the coolest thing. My chart is, I would say it doesn't like vary a whole lot. So I have to like really, I'm glad that I'm like super trained in interpreting it now because it's subtle changes, but I'm able to see when I eat a lot of high glycemic carbs, I delay my ovulation a few days, and then I have lower progesterone in the luteal phase. And then I can see whenever I like cut things out or I have really focused on my stress management. I run a business and I realized through charting that I prioritized the business for the majority of the time that I started it. And I wasn't really like eating lunch and I wasn't planning my own workouts and I was coming home and doing work. And you could really see my progesterone just kind of hovering and not thriving. So the chart was a really good way for me to see how stress manifests and how stress literally robs me of my estrogen, thyroid, testosterone, progesterone. And so that's like one of my biggest things that I'm personally using my chart for. And I've created a lot more boundaries. I deleted my work phone off of my personal phone. I have office hours to check Instagram. I block out lunch on my schedule. I eat breakfast, and suddenly my business is like booming. And
Amazing what boundaries can do and self-care.
It's interesting how all that plays out together, but that's my lessons in charting.
Well, so I want to ask you about something because when we first started in the program at the beginning of the year, your chart and cycle was in a different place than it is now. So I wanted to ask you about that because I feel like you had an initial hurdle and a great win at the beginning with respect to your luteal phase. But now it's been so many months of, like you said, relatively stable cycles after you've made those changes. I feel like it might have slipped into the background. You might have forgot how, I don't know that I would say forgot, but it's not in like front and center anymore. I'm thinking of a conversation that we had like long time ago when your biggest concern was the luteal phase length and the progesterone production. And that was the impetus for all of the changes that you were talking about. Like, so you've done amazing, but maybe share a little bit about that cool win. I think you shared it at the very beginning of the program when you had I think it was a longer luteal phase. I mean, I didn't look at it this morning, but I feel like it was something like that. So maybe share with us that aspect of it, because I remember you shared something about the luteal phase and everyone was like, wow, that's great. And now it's kind of just normal. Now you just normally have a 14-ish day luteal phase.
Yeah. So when you and I started working together, it was actually before the FAMM program started. And I had been charting, just not with this particular mucus like methodology. And it was like every other month, my cycles were like bouncing back and forth between the overall length and then the day of ovulation and then the amount of days in the luteal phase. So it was like this month looked great. That month looked short. This month was back to great. It was just like super all over the place and not consistent. And so pretty much at the 3-month mark of me getting my calories up, prioritizing protein, adding some additional supplements, it was 14 days, like every month, which I think was a result of what I was doing. Like I was working on improving the progesterone, and it seemed like the progesterone really improved. And I personally seem really sensitive to these little changes, and I've got a lot of underlying inflammation going on. So anytime that inflammation reaches a threshold, my temps are like closer to the baseline. I'll shorten in my luteal phase a little bit, but now like I just finished, I'm in a new cycle now, and I had a solid 14-day luteal phase, and I got a blood draw just for fun on 8 days after ovulation, and my progesterone was like 17. And I also,
which is good for anybody who doesn't know.
Yeah.
I think 15, 16 is like what we're the target, right? So you're good.
Sometimes I'm extra. This is not part of the charting, and people don't have to do this, but I like to pee on PDG strips, which is a urine metabolite. I don't do it as much now, but I was like, oh, since I got my blood drawn, let me just pee on a stick and see if it matches. And it was like the top of the threshold. So I was like, okay, I'm pretty good with that. Like things are going well.
Yeah. Well, I love that's again, one of the things I love about it, that I make a point of incorporating it into the program, because I think that it's really helpful just to see what you can do with your own cycle by making certain changes and seeing that. So, it doesn't mean like there's other things that you're still looking at, etc. But I feel like that was a huge win. And I think my favorite part about it is that it just became normal. Like once you took care of it and you were able to kind of sort it out, it obviously was, it's always a challenge to make those changes to the lifestyle factors and etc. But like it just kind of slipped into the background, and now it's just normal to have a 14-day luteal pretty much every cycle. It's not always, I don't even know if I would say it was easy. I feel like it didn't happen overnight either. You said that it took about 3 cycles. So, as we get to the end of our interview today, as we start wrapping up, I would just love to get some kind of final thoughts and everything from you. So for someone who's listening and who is thinking about the FAMM program. So, this program is designed specifically for women's health professionals who have an existing practice, who are wanting to bring fertility awareness into the work they're doing with clients. What would you want them to know about your experience, in terms of how it potentially has changed your practice or changed your outlook or changed the way that you relate to your clients?
That's a great question. There's so many things that I could say. I think that the biggest thing is that it makes me unique. People are coming out from hiding. Like, well, okay, I have pelvic pain, chronic back pain. I also just had a baby, and I wanted to ask you about my progesterone. So I think that's really cool in like setting yourself up to be like a little more unique in your practice. And I think that the biggest thing that I hear from my patients is constantly, no one told me this. I'm going to my other doctors asking if there's anything else I can do besides the pill or the IUD, and they're literally telling me no. And you actually listened to me for an hour, and you're telling me I have decisions I can make on all these different routes. And so I think being able to be confident in charting and not just know about it and what it is two different things. And so I'm able to break it down for people and give people the exact roadmap of today we're starting here, and we'll talk about the rest later. And they're starting, I'm really watching these women come into their own and really take charge of their health and kind of break down that dogmatic belief that my period is just my period and it happens to me and pain just happens to me. And I'm really empowering people to take action, even if it results in small baby steps along the way. So I think that's like the biggest thing that sets you apart if you decide to do like this kind of a program.
Well, and then one of the questions I think which makes a lot of sense for busy practitioners. Obviously, it is a program. There are assignments, there are calls, like it does require time. Would you share a little bit just about your experience as a practitioner in the program and, what you want someone to know if they're like from that practical standpoint of what it's like inside? Yeah. What would you want someone to know about that?
Yeah, so I have been working my full caseload since we started. So I have found some of that a little challenging, but I'm glad that I did it because the calls are recorded. So I prioritize when it's like a client case presentation, I watch it later on 1.5 times. And so that way I'm able to like time manage for myself a little bit better. But I enjoy having this number of calls because I saw like a fertility for pelvic PTs course come out, and it was 1 day long. And there was a 9-minute video about cervical mucus. I was like, oh my God, like, I feel like I'm just like so comfortable with all the different types of mucus, what it means. Like, I just don't understand how you would learn anything in 9 minutes about what mucus tells you. So what I'm saying is that I appreciate how long the program is, really getting the amount of calls, being able to rewatch the calls, even diving into the assignments. They did take me some time, but it said go to chapter 10 of the 5th vital sign and answer these questions. It kind of makes you slow down so you're not just like binge reading everything and then forgetting it.
Well, yeah, I appreciate that. And so just to kind of break it down, the course itself is about 9 months. So that's about the length of it. And then the call frequency, there's a call a week. And then there are additional calls as needed. There's an additional monthly call that's optional for question and answer. And there have been times when if everybody wants to have a deep dive into topic X or whatever, we'll do an extra one, but just to kind of put it out there for that. So I appreciate that because these are the questions people have about the experience of it. And it's a balance that I am trying to create as the instructor of this program and created the program, which is that we can't skirt over the issues. There's no 9-minute video on mucus. Mucus is an ongoing conversation throughout the program. Obviously, it's a big part of the charting modality that we're learning. But my goal with the program has always been to cut out the fluff and keep it to what we really need to know. And so towards the second half of the program, a lot of the calls are the hands-on, bring your charts or your client's charts, their history, background, and we go through and answer a bunch of questions that are really pertaining to you and your client. So I do my best to keep it like to what you need to know. So hopefully that comes through in the program. So as we're wrapping up, any last words, anything you wanted to share, whether it's for the practitioner who's thinking of joining or for the woman who's listening out of interest and who's thinking of diving in and learning how to chart her cycles?
Yeah, I would say I've had a number of clients who came from another like functional medicine doctor or other type of doctor who told them, well, don't worry, you don't need to know when you ovulate. It's too much work. Well, it's going to be too much work if you think it's too much work. But I'm literally like doing it in my sleep. I just wake up, take my temperatures, I check the mucus. I don't even remember what I wrote down yesterday. It took me like 2 seconds. And so I would say don't let people make you feel some kind of overwhelm. It's just a matter of breaking things down, learning every day, and then having someone to tell you you're on the right track and kind of validate like what you're seeing. So don't listen to that stuff.
Yeah, it's like that patronizing. I always picture, that paternalistic, like patting on the head, like, oh no, sweetie, that's too much work for you. It's like, I'll tell you what's too much work for me. Leave me alone. Yeah. So share with us then where you are located. Where's your physical practice? Share all the details, how, for all the lucky people who are close to you, who are now going to want to run to your clinic. But share with us where we can find you also on socials. You mentioned Instagram, your website, et cetera, et cetera.
Yes. So my Instagram is where I'm most active. It's Dr. Mel Thompson, Dr. Mel Thompson. And my website is louisianapelvichealth.com. At this time, my clinic is in Houma, Louisiana, which is about an hour from New Orleans. And I also have online digital coaching rehab programs for women. So I'm able to do assessments and consults virtually from anywhere in the world. So if that is something you're looking for, I can also help you with that. I think that was all that you asked.
Cool. Well, I'll make sure to put the links to all of the places. So for anyone who's listening on the go, you can just scroll in your app or whatever, and you'll see all the deets. And hopefully you'll connect with Melissa on the socials. And yeah, it's been a great opportunity and so much fun talking to you today. I always love doing these episodes because although we have been talking pretty consistently and regularly for quite a while, it was really fun to pick your brain and to learn a little bit more about the nuance of the work that you do in your field. So I really appreciate you taking the time to share that with us today.
Yeah, thank you. It's been fun.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/438. I hope that you enjoyed today's episode with Melissa. It was such a treat for me to be able to pick her physiotherapy brain and highlight the importance of treating and being aware of issues related to pelvic health and pelvic floor health. And listening to Melissa talk about the most common issues that she sees in her practice, and just thinking about how many women are struggling with these problems who aren't necessarily talking about them and may not know where to go for support for them. I feel that it's just so important to continue to raise awareness. And given that as I'm recording this episode in real time here in fall of 2022, I have just recently given birth. And given that it's my third baby, I'll share at some point on the podcast what my experience has been post-birth. But I'm feeling very thankful that I was aware of many of these resources and that I have been able to access any resources that I need within my community. Knowing where to go or where to turn is the first step. And so hopefully this podcast has been helpful to you. If you know somebody who could really benefit from hearing this information, then I do encourage you to share it. Again, the share link is fertilityfriday.com/438. And I think one of the most encouraging aspects of today's episode is knowing that not only is there support available for some of these difficult challenges that we may or may not be comfortable talking about, but also that there's a really good success rate. So hearing Melissa talk about how she is able to support her clients in so many of the cases, it can be really scary if you've given birth and you're starting to have some of these issues, whether it's bladder control issues or whether you have some degree of pelvic organ prolapse. That can be terrifying. The idea that your organs could be out of place or potentially falling out is just one of the most terrifying thoughts. And so to know that not only is there support, hopefully close to where you live, if you are needing the physical support in this situation, but also that there's a high rate of success can be so comforting, especially if you have dealt with an issue like this or had concerns and you have spoken to a doctor who's presenting the surgical options. It can be really helpful to know the other less invasive options that are available to you before you have to go down that route. So with that said, I hope you have a wonderful weekend whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting.